Welcome back to Speak Easy English.
Hi, Emma. Hi, listeners.
Today we are talking about describing symptoms.
Very useful. I need this.
Good. This helps at a pharmacy or with a doctor.
Right. I get nervous at a clinic.
Me too. Simple phrases make it easier.
I like that.
First, I will teach basic phrases to say what you feel.
Great. Start simple, please.
A very common phrase is, I have a headache.
I have a headache.
Nice. Repeat it slowly.
I have a headache.
Good. This says the pain is in your head.
Okay, that is clear.
Another phrase is, I have a fever.
I have a fever.
That means your body feels hot and you might be sick.
So fever means high temperature.
Yes. You can also say, I have a sore throat.
I have a sore throat.
That means your throat hurts when you swallow.
I see.
Next simple phrase, I have a cough.
I have a cough.
Good. You can add, it is dry or it is wet.
It is dry.
Say, my cough is dry.
My cough is dry.
Another common one is, I feel dizzy.
I feel dizzy.
That means you feel lightheaded or like you might fall.
Okay, that helps.
A useful phrase is, I feel nauseous.
I feel nauseous.
That means you feel like you will throw up.
I will remember that.
Now, practice a short set.
Okay.
Say, I have a headache and a fever.
I have a headache and a fever.
Good. Now add duration.
Duration?
Yes, say how long the symptom has lasted.
Show me phrases, please.
Use for 2 days.
For 2 days.
Or say since yesterday.
Since yesterday.
Combine them. For example, I have had a fever for 2 days.
I have had a fever for 2 days.
Very clear.
What about hourly symptoms?
Use the word sometimes or often.
Sometimes and often.
For example, I sometimes feel dizzy.
I sometimes feel dizzy.
Or I often cough at night.
I often cough at night.
Good.
How do I say the pain level?
Use mild or severe.
Mild and severe.
Say, my headache is mild.
My headache is mild.
Or my pain is severe.
My pain is severe.
You can also use numbers from 1 to 10.
1 to 10 scale.
Say, my pain is a 6 out of 10.
My pain is a 6 out of 10.
That helps the doctor understand intensity.
Very useful.
Now, location words. These are small but important.
Like where it hurts.
Yes. Say, in my chest.
In my chest.
Or in my stomach.
In my stomach.
Or in my left side.
In my left side.
Combine words now.
Okay.
I have sharp pain in my lower back.
I have sharp pain in my lower back.
Good. Sharp is a quick, strong pain.
And dull is different?
Yes. Dull means steady and not sharp.
My headache is dull.
Perfect. What about throbbing? Throbbing means you feel pulses of pain.
My tooth is throbbing.
Good example. How to say the symptoms started?
Use words like started or began.
I started to feel sick yesterday.
Yes, or it began this morning.
It began this morning. Now, some helpful phrases to ask questions.
Like when we need help.
Yes. Say, do I need to see a doctor?
Do I need to see a doctor?
Or ask, can I take this medicine?
Can I take this medicine?
Pharmacists will like that. What about describing allergies?
Good point. Use the phrase, I'm allergic to.
I'm allergic to penicillin.
Great, that is important.
Also say if you take medicines.
Yes, say, I'm taking blood pressure medicine.
I'm taking blood pressure medicine.
Or I take insulin.
I take insulin. That helps the professional avoid bad interactions.
Right.
Let us practice a full short conversation.
I am ready.
I will be the pharmacist.
I will be the patient.
Hello, how can I help you?
Hello, I have a headache.
How long have you had it?
I have had it since yesterday.
Do you have a fever?
Yes, I have a fever.
Is your headache mild or severe?
It is mild.
Are you taking any medicine?
I am taking paracetamol.
Any allergies?
I am not allergic to anything.
You can try rest and fluids.
Thank you. Can I take more paracetamol?
Check the dose on the box.
Okay.
That was good.
That felt realistic.
Now learn phrases for emergency feelings.
Okay, emergency words.
Say, I am short of breath.
I am short of breath.
That means you cannot breathe well.
Right, that is serious.
Also say, I have chest pain.
I have chest pain.
That may need immediate help.
I will remember.
Use the phrase, I fainted,
I fainted.
or I feel like I will faint.
I feel like I will faint.
Those help the doctor act quickly.
Clear.
Now teach language to say the symptom pattern.
Pattern?
Words like constant and comes and goes.
Constant and comes and goes.
Say, my pain is constant,
My pain is constant.
or the pain comes and goes.
The pain comes and goes.
That tells the provider if the symptom is steady.
Useful.
Next, we add simple adjectives for color or appearance.
Like red or swollen.
Yes, say, my arm is red and swollen,
My arm is red and swollen.
or my throat looks red.
My throat looks red.
Keep it simple.
I will.
Now we will practice 6 key patient phrases you can repeat.
Perfect. I like lists.
Phrase 1, I have a headache.
I have a headache.
Phrase 2, I have a sore throat.
I have a sore throat.
Phrase 3, I have a fever.
I have a fever.
Phrase 4, I feel dizzy.
I feel dizzy.
Phrase 5, I feel nauseous.
I feel nauseous.
Phrase 6, I am short of breath.
I am short of breath.
Good. Those 6 phrases are important.
I will practice them.
Now expand one phrase with time and severity.
Show me.
Say, I have had a sore throat for 3 days.
I have had a sore throat for 3 days.
Now say, my throat pain is severe.
My throat pain is severe.
Good.
How do I say the symptom is better?
Use the phrase, it is getting better.
It is getting better.
Or say, it is getting worse.
It is getting worse.
Both are simple and clear.
Okay.
Now a short role play at the clinic.
I like role plays.
I will be the nurse.
I will be the patient.
Tell me your main problem.
My main problem is a cough.
How long have you had it?
I have had it for 5 days.
Is it dry or wet?
It is wet.
Any fever?
I had a fever 2 days ago.
Do you feel short of breath?
No, I do not.
Do you have chest pain?
No chest pain.
Do you take any medicine?
I take allergy medicine.
Any allergies to medicines?
I'm allergic to penicillin.
Thank you, that helps.
That was a good flow.
Now, tips for saying things clearly.
I need tips.
Speak slowly.
Speak slowly.
Use simple words.
Use simple words.
Say one idea per sentence.
One idea per sentence.
Use for or since with time.
For or since.
Use mild or severe for pain.
Mild or severe.
Say where the pain is.
Say where the pain is.
Use short phrases for emergencies.
Short phrases for emergencies.
Now, a short listening pause for the audience.
Okay, I will wait.
Think of your last visit to a clinic.
I remember that.
Try to say 3 phrases out loud.
I will do that now.
Say, I have a fever.
I have a fever.
Say, I have a sore throat since yesterday.
I have a sore throat since yesterday.
Say, my pain is a 7 out of 10.
My pain is a 7 out of 10.
Great job.
That felt natural.
A few cultural tips now.
Cultural tips?
Be polite and direct.
Be polite and direct.
Say please when asking about medicine.
Please when asking about medicine.
If unsure, say, I am not sure.
I am not sure.
That helps the professional ask more questions.
Makes sense.
Now, some common doctor or pharmacist questions to expect.
Good.
I want to know.
How long have you had this?
How long have you had this?
Any other symptoms?
Any other symptoms?
Are you on any medicines?
Are you on any medicines?
Any allergies?
Any allergies?
These are short and easy to answer.
I will remember them.
Now practice a slightly longer scenario at a pharmacy counter.
Ready.
Good morning. How can I help you?
Good morning. I have a sore throat.
How long have you had it?
Since yesterday.
Do you have a fever?
Yes, I have a fever.
Are you taking any medicines now?
I take allergy medicine.
Any allergies to medicine?
I'm allergic to penicillin.
I suggest a throat spray and rest.
Thank you. How many times a day?
Use as directed on the label.
Okay.
That was practical.
Listeners will like this.
Now, short corrections to common mistakes.
I make mistakes.
People say, I feel headache.
I feel headache.
Correct phrase is, I have a headache.
I have a headache.
Another mistake, I have been since 2 days.
I have been since 2 days.
Correct is, I have had it for 2 days.
I have had it for 2 days.
One more, my temperature is high since morning.
My temperature is high since morning.
Better, I have had a fever since this morning.
I have had a fever since this morning.
These small changes sound more natural.
I see the difference now.
Next, we will practice combining phrases.
Combine them.
Say, I have had a headache and fever for 3 days.
I have had a headache and fever for 3 days.
Now add severity. My fever is mild, but my headache is severe.
My fever is mild, but my headache is severe.
Excellent.
This is getting advanced.
It is still simple language.
True.
Now a quick checklist you can say at a clinic.
A checklist sounds helpful.
I will say each item slowly.
Okay.
I have a cough.
I have a cough.
I have a fever.
I have a fever.
I feel dizzy.
I feel dizzy.
I feel nauseous.
I feel nauseous.
I am short of breath.
I am short of breath.
Also, remember duration phrases
For 2 days and since yesterday.
and severity words
Mild and severe.
and location words.
In my chest and in my stomach.
Great, that's a solid list.
Thank you, Emma.
You did a lot of good practice.
I feel more confident now.
Say one final sentence for practice.
Okay.
Tell me your main symptom and how long.
I have had a sore throat since yesterday.
Perfect.
Thanks, Emma. This was clear and practical.
You're welcome, Jack.
And thank you, listeners.
See you next time for another episode.
Bye, everyone.